How to manage pulmonary embolism in emergency situations. Pulmonary embolism, PE, is a serious and potentially life-threatening condition caused by the obstruction of a pulmonary artery by an embolus, typically a blood clot that has traveled from the deep veins of the legs or other parts of the body. Managing a pulmonary embolism effectively in emergency situations is crucial for patient survival and recovery. This article provides an in-depth guide on how to handle PE emergencies, including recognition, diagnosis, treatment, and follow-up care. 1. Understanding pulmonary embolism. 1.1. What is pulmonary embolism? Pulmonary embolism occurs when a blood clot or other substance blocks one or more arteries in the lungs. This obstruction impairs blood flow, leading to decreased oxygen supply to the affected lung tissue and potential damage to the heart and other organs. 1.2. Causes and risk factors. The primary cause of PE is deep vein thrombosis, DVT, where blood clots form in the deep veins of the legs or other parts of the body and then travel to the lungs. Risk factors include prolonged immobility, recent surgery, certain medical conditions, pregnancy, and genetic predispositions. Recognizing symptoms. 2.1 Common symptoms. The symptoms of pulmonary embolism can vary, but often include sudden shortness of breath, chest pain, which may be sharp or stabbing, rapid heartbeat, coughing, which may include blood, dizziness or fainting, and swelling in the legs. 2.2 Diagnostic challenges. Symptoms of PE can mimic other conditions such as heart attacks or pneumonia, making prompt and accurate diagnosis essential. The presentation can range from subtle to severe, depending on the size and location of the embolus. 3. Diagnostic approaches. 3.1 Initial assessment. Upon suspicion of PE, a thorough clinical assessment is critical. This includes a detailed patient history, physical examination, and evaluation of risk factors. 3.2 Diagnostic tests. D-dimer test. Elevated levels of D-dimer can suggest the presence of an abnormal blood clotting process. However, this test is not specific to PE and may be elevated in other conditions. Imaging, CT pulmonary angiography, CTPA. This is the primary imaging technique for diagnosing PE. It provides detailed images of the pulmonary arteries and can identify the presence of clots. Ventilation perfusion, Q-scan, used when CTPA is contraindicated or unavailable. This scan assesses airflow and blood flow in the lungs to detect mismatches that suggest PE. Ultrasound. Doppler ultrasound of the legs can be used to identify DVT, which may be the source of the embolus. 3.3 Confirmatory tests. Arterial blood gas, ABG, analysis helps assess the extent of impaired gas exchange. Electrocardiogram, ECG, can identify signs of right heart strain or other cardiac complications associated with PE. 4. Immediate treatment. 4.1 Anticoagulation therapy. Heparin, administered intravenously or subcutaneously. Heparin is used to prevent further clot formation and allow the body to dissolve existing clots. Low molecular weight heparin, LMWH, administered subcutaneously. LMWH is often used in the initial management of PE due to its ease of use and predictable pharmacokinetics. Direct oral anticoagulants, DOACs. These may be used in some cases for longer-term management after initial treatment. 4.2 Thrombolysis, thrombolytic agents. Medications such as tissue plasminogen activator, TPA, may be administered to dissolve large clots rapidly, especially in cases of massive PE with hemodynamic instability. SOR 4.3 Supportive measures. Oxygen therapy administers supplemental oxygen to improve oxygenation and alleviate respiratory distress. Fluid resuscitation may be necessary to maintain blood pressure and improve circulation, especially if the patient is in shock. Pain management. Administer analgesics to manage chest pain and discomfort. TASH-Dive 5. Patient stabilization. 5.1 Monitoring and support. Continuous monitoring. Regularly monitor vital signs, oxygen saturation, and cardiac function. Continuous cardiac telemetry may be necessary to detect arrhythmias or other complications. Intensive care. Severe cases may require admission to an intensive care unit, ICU, for advanced monitoring and treatment. 5.2 Preventing complications. Complications. Watch for potential complications such as bleeding from anticoagulation, shock, or right ventricular failure. Prevention. Implement strategies to prevent complications such as using compression stockings and encouraging early mobilization. 6. Collaborative care. 6.1 Multidisciplinary approach. Effective management of pulmonary embolism often involves a team of healthcare professionals, including emergency physicians, intensivists, cardiologists, and pulmonologists. Collaboration ensures comprehensive care and optimal outcomes. 6.2 Communication. Maintain clear communication among team members and with the patient and their family. Providing education about the condition and treatment plan helps in understanding and adherence to the care plan. 7. Follow-up care. 7.1 Ongoing management. Long-term anticoagulation. Patients may require extended anticoagulation therapy to prevent recurrence. The duration and type of anticoagulant therapy will depend on individual risk factors and response to initial treatment. Regular follow-up. Schedule follow-up visits to monitor the patient's progress, manage any side effects, and adjust treatment as necessary. 7.2 Lifestyle and risk reduction. Lifestyle modifications. Encourage patients to make lifestyle changes to reduce their risk of future clots, such as increasing physical activity, maintaining a healthy weight, and avoiding smoking. Education. Provide education on recognizing symptoms of recurrence and the importance of adhering to treatment and follow-up recommendations. Conclusion. Managing pulmonary embolism in emergency situations requires a swift, coordinated approach to diagnosis and treatment. Recognizing symptoms early, implementing effective diagnostic strategies, and providing prompt treatment are crucial for improving patient outcomes. By following established protocols and collaborating with a multidisciplinary team, healthcare professionals can effectively address this serious condition and enhance patient safety and recovery.